Hi, I'm Dr. Terry Magruder, and today we're going to be talking about asthma medications and asthma action plans. The objectives for this presentation are for participants to be able to understand the difference between quick relief and controller medications. You'll be able to identify common asthma medications and devices. You'll be able to observe demonstrations of correct device technique for various inhaled medications. And you'll be introduced to the asthma action plan and how it is utilized to guide asthma self-management. First, we will discuss quick relief medications. These medicines work to relax tight muscles in the airways to make breathing easier. They are typically used to relieve asthma symptoms. All people with asthma need quick relief medications. Quick relief medications typically relieve asthma symptoms for a short period of time, around 4 to 6 hours. These medicines do not prevent symptoms from returning once medicines have worn off. Asthma patients should have quick relief medication available to them at all times and use them as soon as symptoms start. This next slide is a pictorial of quick relief medications. As you can see, most of these medications are inhaled. They come in metered dose inhalers or a respiclick form or in a liquid form that goes in a nebulizer. It is important to teach families to pay close attention to the amount of quick relief medications they have in their inhalers by checking the dose counters on the back of the inhaler. The next common asthma medication we will discuss are controller medications. These medications are for patients with persistent asthma and are used daily to reduce inflammation present in the airways. They are used to reduce frequency and severity of asthma symptoms. These medications are typically taken every day whether a child is sick or well to prevent airway swelling and narrowing. They are usually prescribed to be taken either 1 to 2 times a day. It is really important that families understand that controller medications do not provide quick relief. If symptoms are present, quick relief medicines should be added to the use of controller medications. It is also important for families to realize controller medications are typically given at home. There's really not a role for controller medications to be at school. Controller medications should travel with a patient only if they are spending the night out or are going to be away from home during the next dosing time. This is a pictorial of typical controller medications. The majority of these controller medications contain inhaled corticosteroids to decrease inflammation and reduce asthma symptoms. They are typically always given in an inhaled form. There are some medications that are given orally that do not contain oral steroids, such as montelukast, accolate, or Zyflo. In some patients with more severe asthma, they may be on Xolair or Nucala, which are biologic medicines that are typically prescribed by an asthma specialist. As with quick relief medications, these controller medications often have dose counters on the back of them. It is very important that families recognize that most of these medications are dispensed as 1-month supplies. So typically these inhalers, if used correctly, should run out every month. It is not typical for patients to be on more than one of these controller medications at one time. If a patient has multiple controller inhalers at their home, please clarify the correct medicine with pharmacy and the physician to limit confusion. Also, to be sure to confirm the strength of the controller medicine is appropriate and as prescribed. It is not uncommon that different doses look very similar to patients, so they may be using the wrong inhaler, thinking it is the appropriate strength. It is very important for families and patients to understand how to use their inhaled medications correctly. Spacers are devices that help guide inhaler medicine to the lungs to ensure optimal delivery of the medicine deep into the airways. It is very important that patients are shown how to use their inhalers with the appropriate spacers. There are different types of spacers, and they are prescribed based on a child's age, coordination, and developmental level. Patients should use spacers with all their metered dose inhalers. You will now see a short video of how to use a mouthpiece spacer.
Remove the caps from both the inhaler and the spacer. Shake the inhaler. Insert the inhaler into the spacer. breathe out. Seal your lips around the spacer mouthpiece. Press the inhaler down once and breathe in slowly and deeply. If you hear a whistle, you're breathing in too fast. Remove the spacer and hold your breath for 5 to 10 seconds. Breathe out. If another puff is required, wait at least 30 to 60 seconds and repeat all these steps. Replace the caps and then rinse your mouth with water. Please note, if you are unable to hold your breath, take 6 normal breaths instead.
You will now see a demonstration of using a spacer with a mask.
Giving an inhaler to an infant can be challenging, but it is possible. Until your child gets used to it, they may cry and try to fight the mask. Practicing with dolls or teddy bears can be helpful for your child. If your child is crying uncontrollably, you may want to wait until they are calmer. First, we need to remove the cap from the inhaler. Shake the inhaler and insert the inhaler into the spacer. Hold your child on your lap and apply the mask over her mouth and nose from behind. Use your hands to seal the mask to your child's face, as the child may be crying, twisting, or turning. Press the inhaler down once. Watch your child take in at least 6 breaths. If you hear a whistle, she's breathing in too fast. Remove the mask from her face. Replace the caps and have your child have a drink and wash their face. If another puff is required, wait at least 30 to 60 seconds and repeat all these steps.
There are additional resources available for different types of devices that do not use a spacer. These can be found on all of the websites for these individual devices, and additionally, demonstrations can be viewed on Boston Children's Hospital website at the website listed on your slide. The next medication delivery system we will discuss is nebulizers. Nebulizers are small portable machines that turn liquid asthma medicine into a mist that can be inhaled using a mask or a mouthpiece. General information about nebulizers is listed below. Both quick relief and controller medications can be delivered through a nebulizer, but it is most common to see quick relief medications delivered this way. There are many different brands of nebulizers. It is important for families to know what durable medical equipment provider provided them with their machines so they have access to replacement parts and service as needed. The nebulizer will come with a manufacturer's recommendation on when to replace tubing, mask, mouthpiece, and filters. Some of these parts are designed to be replaced every 2 weeks, and some may last up to 6 months. Next, we will discuss asthma action plans. Asthma action plans are written treatment plans that are developed by a patient's doctor to guide asthma management at home and how and when to seek medical treatment when patient is experiencing symptoms. It is very important that all children with asthma have an asthma action plan. It provides detailed instruction on what to do every day to manage asthma and what to do if your child is having increasing symptoms. Many asthma action plans are set up like a traffic light, with a green, red, and yellow zone based on symptom frequency and severity, as you can see in the pictorial of an asthma action plan on the top right hand of your screen. Typically, green zone is a child is doing well. They are having very limited symptoms. It is their everyday asthma routine. Typically, this is where controller medications are given every day. As a patient starts to develop symptoms, they often move into their yellow or red zone. Yellow zone tells the patients and their families how to increase their medications and adjust therapies to treat their asthma symptoms. It also directs when to call a physician or seek medical treatment. Additionally, the red zone is when a patient is experiencing very severe symptoms. Typically, in this zone, it is an emergency situation. Patients are directed to use quick relief medications and seek either urgent care or call 911, depending on the recommendations of their physician. The key to the asthma action plan is not for the family to simply have one in a folder or stuck on a refrigerator, but to understand how and when to use it. These asthma action plans are very important for children that have multiple care providers. Thank you for joining us in this presentation of asthma medicines and asthma action plans. Please join us for additional asthma trainings, including asthma basics, asthma triggers and environmental assessments, and keys to a successful asthma home visit.